Good afternoon and welcome to the webinar. October 10th, can you believe it? There is definitely a little chill in the air. It feels like fall. Fall's finally arrived here in Southern Ohio, and I'm sure has in the rest of Ohio. And we're so glad you've joined us today. We have a full house and a full deck of discussion here. We're going to talk about the Ambetter 2024 product preview, and let's just get into some housekeeping. You know the drill. Questions go in the question box, and by all means, if you got any issues, technical issues, or the sound's a little wonky, or you just want to say hello, you can just put those in the question box, and I'll try to address those as we go along, and we'll try to jump in periodically with questions if there's an appropriate break. Otherwise, we'll deal with them at the end of the presentation. And here we are, the three amigos of the individual department. And Eric's got his camera off, but Eric's here. And by all means, jot down our contact information if you have any questions. We're in a very busy period, extremely busy. So your time is very valuable. You can get a lot done just by shooting an email to us, and you can stay on the phone or whatever, and we'll try to get back to you in real time or within 24 hours. So use us, please use us. And Eric wants to talk about Health Sherpa.
Yep, thanks, Jeff. So Health Sherpa is our ACA enrollment platform that we use here at Cornerstone. It's pretty easy to get set up. We have a link that you can go to and just ask for some basic information. That way we can get a link sent out to you to set up the account. It's a lot quicker than going to healthcare.gov, I think, is getting all your quotes out on Health Sherpa. And it's no cost to you, and we cover everything for that. You can do your drug and provider searches and get real-time status updates on all of your clients.
Fantastic. Okay. Next order of business, Brad, you're up.
Oh, hey, my turn. All right, everybody, you're on, so thank you very much for that. And you all know people and agents that you see at different roadshows. And, I hear the chatter as I now am on this side of the fence to get to sit at the table and not at the front of the room. And so I know the conversations are great between all of you. So if you have somebody that mentions they're really got to find a new GA or FMO, whatever they're calling it, definitely refer Cornerstone if you're satisfied. We'll actually, once that, you're only going to recommend people who can write business, no slackers. So once they write a piece of business, we'll actually give you a $250 bonus as a thank you gift over that 6-month period. But if they write it in the first month, I think you get it sooner, right, Jeff?
Yeah. We'll pay it to you as soon as we do the numbers and make everything sure it's it's sticking on the books.
There you go. Thanks for that.
Okay, great. Check it out, everybody. It works. And I'm going to toss things to our friend Shondell Coleman. He's your broker rep for Ambetter, and let's get this over to Shondell.
Perfect. You still hear me okay, Jeff? Just
yeah, I'm gonna make you the presenter.
Okay, perfect.
So glad you could join us. There's so much going on, and
yeah,
so much going on right now.
All right, great. So welcome everyone. I do appreciate you taking time. I know everyone is so busy, and open enrollment is creeping up on us, as well as Medicare going on. So I do appreciate you all taking this time. So I'm Shondell Coleman. I represent Cornerstone, the agency, and the Midwest region, as well as other states surrounding that. Been with Ambetter for about 6 years. I've grown a lot of information I've obtained, as well as partnerships. And I do appreciate you all, because you are the reasons we are continuing to grow. So just to move into it, and Jeff, let me know if I'm, taking too long or so. It is a lot of information. I do want to move forward as quick but beneficial as I can with this information. So I'm gonna go ahead and see if I can move forward. There we go. Perfect. So this is going to be some information just refreshing to any existing agents out there, but any new agents out there. This will be, just new information for you. But we recognize ourselves as being the #1 top carrier in all of our states. Aside from 7 people shopping, they choose Ambetter based on being its brand, its pricing, as well as a network. We recently grew 3 million plus members. So we wasn't expecting that much last open enrollment, but that was definitely a plus for us to hear those news. So thanks to you all, kudos. And the plans that we have some great plans that I'm going to talk to you all about as well. We've been in the business since Ambetter, since the ACA pretty much started. It used to be called Celtic back in the day. All right, so Delaware is the new expansion state that we're going to be entering. The agency, or if anyone out there has some interest in Delaware expanding, do let us know. But that is the only state we'll be expanding into. All right, just mark your calendars for the renewals. We have sent renewals out September, as of September, for any plans that have discontinued. I don't think we had anything with Ohio. Ohio was pretty consistent out there in the market, but just FYI, how we do that, as well as October, we send out those renewal letters to the members, letting them know they plan to continue on the plan. Good question to know that you all do not get copies of these. We do send those out to the member directly. So as you know, the December 15th is the last day to enroll for coverage for those January 1. And then we have the February 1 coverage effective date for those that's going to enroll after December 15th. So that's going to continue on. So some updates, Ambetter Telehealth is now going to be virtual 24/7 care. We also have our member reference guide that's going to be going digital. We tend to see members out there, and I'll see later in the slides, that, rather than getting all these papers and mailing, we saw that there was some interest in going digital because people are always on their phones. We also renewing the URLs for each state that's on the site. Usually it's ambetterhealth.com, but it's state specific. So in this case, it's Superior Health Plan. Discontinuance, we will be discontinuing Babylon Health, which is going to be impacting some states out there for the virtual access plan. But it will continue in the states where Teladoc Health is provided. And then this virtual 24/7 care is going to be available in these following states.
So just jump in here. Teladoc Health, that's an actual provider name. I think the guys in Ohio, we were subject to Babylon. So, that's big news.
Yeah, yeah. Yep, no, absolutely. So, it is big impact news we've heard, but like I said, some states were impacted by it. Some reminders, the tax credit, those are going to continue on. $0 copay for telehealth appointments through the Teladoc Health Services. My health pays, that's going to continue, obviously, because it's such a great program where you can earn up to $500, reduce your premium by $41, and I'll talk about that later. And then you have access to the enrollment tool. I know a lot of people use their own Health Sherpa or personal account or so, but we do offer that platform, and we do work with Health Sherpa as well with those enrollment tool. Okay. For that, so what makes us really the strong partnerships is the competitive commissions that we do pay. We pay on new and renewing members. You also get knowledgeable account executive like myself that's here to assist you and support you in the best way that I can. You do have a great broker support team given to you in case you have questions around member issues and enrollment issues, and etc. More down the line as I speak. And then you have the broker portal, where you have each agent have access to the manage their book of business, any new business coming through. All right, some of the success, the tips out there. We want to consider the opportunities in the states and counties that Ambetter expanding into, and we want to take in consideration what counties we want to be targeting. And make sure you ensure your clients that they do understand their coverage and plans that they are selecting. Communicate with those existing clients For the renewals, although those do roll over, I know those going to be in the slides. Do encourage your clients to act as quickly as they can so they can get that coverage effective for January 1. So again, I'm gonna be moving forward because it is a lot of information here. So broker portal. So each agent do have access to their own broker portal where they can keep track of all their book of business. Here's our sales support line, broker sales support line, and then their option 2, and then you have their email. So I will take consideration this information, as we get to open enrollment, and it's going to be really busy, but just take advantage of those support systems that you have. So there's a broker portal quick reference guide in your portal. Just then you know how to work the portal, what's in the portal, etc. That is offered to you. This is the home page for the broker portal. For this case, you have principals only that can see this. But once you have yours, you can see the same information. You do have access to some of the resources, and then you get all this nice color down here that can break down into your active members, your delinquents, who's behind, and as well as unpaid binders. And that is the URL for the brokers, your portal, broker.ambetterhealth.com. If you don't know your login, you can reach out to our broker support. So in your portal, you are able to sort and filter the data to generate these reports. You are able to download as well into Excel file that you can see these are numbered. So it tells you how to filter, column, export, etc. All right, member details. So if you click on the member of the policy, you're going to get these details. So you see the premium, the tax credit, as well their responsibility, see their dependents, their my health pays. It will let you know if they are enrolled. It won't tell you the dollar amount or where they are, but it will tell you if they're enrolled. So that is new that they did implement into the system. And then ID cards, in case you need to order any ID cards or send them out, you do have access to that. And then the plan A. All right, so just talking more about the tasks here, paid due responsibilities. So let's just move forward with the reports. Delinquent reports. In case your member is behind, you can do so from the portal because you do have quick pay. You just need the policy number, date of birth, and the zip code to do so. So just keep in mind, policy is not effective until the binder payment is received. So just make sure you're looking and referencing your portal or whatever platform you use to make sure that's that you're showing as the agent of record. So the client does have 30 days from the effective date to make that binder payment. So that's very important. These are just some quick access. So in case from the portal you need to make a quick pay, you want to enroll a client, you can do so from there, or you need to find a provider. You can do so for those tabs in your portal that will take you quickly there. FAQ, so in case you got some questions out there, you may can find that in your portal under the resources tab. So we do send out a lot of email communications, broker news to all agents that are appointed with Ambetter. So under that resources tab, under the forms, you have these 3 sections: forms, training materials, and marketing materials. So under forms, you got broker release, direct broker and principal changes. Training materials, you have the tutorials, plan information, reference guides, and then the marketing materials, which are state specific in case you are appointed in other states. And you have social media guide as well as bilingual information if members speak English, Spanish, etc. That information is there in your portal. I do want to note that in case anyone out there is needing, I like to call it Ambetter swag. We do have like stress balls, pens, and some other goodie stuff. Let me know. And then we can talk about your event and what you may want. But do go through me, in case you have some events and you want to get some Ambetter stuff. Training materials. So in that training material, like I said, they are state specific according to the state that you are in. You'll find like some network guide, my health pays in there. I do want to point this out. Ambetter do not promote this, the adult vision and dental, anywhere out there. So there is a copy of this in your portal, so you can see how is that covered. So I know we get quite some questions on that as well. There are some other information here as well, tutorial on how to work the enrollment platform and other stuff. The training materials, I'm not gonna go through, each one, but, you're just going a little bit in depth on what you can find in your portal, some of the guides, and then also, just some of the top reasons you can sell, just to sell some of those selling points to the member. I know one of those good sellers are my health page. So, if, for example, if we are having a disadvantage in pricing, that can be, advice to the member, let them know that's offered to them where they can reduce their premium by $41. So that'll be talked about too later on. So again, I said in the marketing materials, you do have options in different languages in English or need be. And these are some flyers. Again, they are state specific. So you have to click on, whatever state that you're appointed in that may reflect that. Your profile, so you are able to edit your profile from the portal. In your portal here, you are able to reset your password in case you have any issues. Principals, on the other hand, can assign delegates. So they have admin or etc. They can delegate the access to them. They have access to the portal. And then profile tabs, you'll see the applications, anything in progress, licenses, and contracts. It's very important. I think it's in another slide. It's not, but I'm gonna just say that. But it's very important. Just because you're licensed in a given state does not mean that you're appointed in that state. So keep in mind, pay attention to contract status in the portal. That's going to tell you if it's active, if it's pending, or if it's anything. But just to let everybody know that, make sure that you have all the states that you want before open enrollment. Tips and reminders. So, just a reminder to leverage your dashboard, the payments, broker communications as we send out to all the agents, the FAQ that's in there, as well as the broker support sales team we have. Ambetter guide. So this is the find a provider guide. So this is the URL. I would like everybody to save it, but guide.ambetterhealth.com is where you can go to look up any in-network for Ambetter. You do have options to log in to get the most accurate results, but you'll still get the same if you don't have to log in either way, or if you don't have a plan, you'll get the same information there. So just make sure that you select the state based on the state coverage here, as well as the county that you're looking for. The network in this case, and Florida has different networks, so they have select value in the core plans. So depending on the state that you are appointed in and the members out of, you want to make sure you select that that network. Here's the home page. So you are able to make some edit there just to make sure you're on the right plan. You can start out, just for example, putting a PCP. You do want to be sure that you put the right information, the right name, because if you're off by like a letter or something, it can mess up. So just make sure you have all that information handy in case you look up a PCP or a hospital or anything of that nature. So once you pull up the providers, it will give you more information on who the
Can you
provider
hear me,
is, the
Shondell?
address, review their profile there to give you more information about their NPI that you can find, contact information, and other information as well.
Hey, Shondell, can you hear me?
Yeah, I hear you perfect.
Oh, fantastic. Did have a question. I just want to go back one slide. What was the website for the guide?
Yeah, I can definitely go back. No problem. Sorry. Wait, I'll just say it if you don't mind, but it's guide, which is GUIDE, guide.ambetterhealth.com.
Okay, great.
Yep. Sorry about that, Jeff. I'm trying to
No worries.
go back there. Yeah. I do want to point this out, right? I do want to avoid as much issues as we can with network, right? So there is a section in here where you can send issues, and that goes directly to our provider relations team. But we don't have time of just waiting and waiting. But Jeff or the team, if you all have any network issues, they're showing in network for any case, any reason, they're not taking them better, send those to me. And I can make sure we get those as
Hey, Jeff,
as soon as
maybe
possible.
Shondell should
But yeah, I just
go.
want to share that because it's busy.
Jeff, let's have Shondell use his get off of his wireless because I think that's where the interference is.
Not well in some of our states or counties. But in this rewards program, it's just a way for them to earn different points that can earn up to dollars just by doing simple different activities. They start by doing a survey, they watch a video, reading an article, etc. Again, these are redeeming points that will convert into dollars, where they can use it for healthcare costs, bills, and some goodies that we have in our reward store. So again, earn up to $500 in rewards. There are different screenings and stuff that you have to do into getting these points. You do have to do this all through your member portal. Through the members portal, they have to create an account through, so they can have access to doing this. If there's anything they miss, they can always follow with customer service so they can make sure that can be counted for. So earn these points to eat right, move more, be well, and save smart. Again, these points are used to shop in the reward store. They get this great raspberry color here, debit card. I do want to at least take up my health pays.
Hey, Shondell.
So some of the healthcare costs, premium, doctor copay, deductibles, Cornerstone. Oh, yep.
I got a question. We're having a
Go ahead,
little
Jeff.
difficulty with the sound. So I'm wondering, is
Okay.
there another option? Are you using like a wireless headset? I wonder if that's the issue.
Maybe just go and use your laptop, Shondell. Let's try that because I think the Bluetooth in your headset might be.
I could definitely try another.
You want to call in on the phone?
Headset might be.
You could probably call in.
Yeah, I mean, I could do that. Let me do real quick. Yeah. Let me do it really, really fast. Sorry, you all wanna.
I'm sorry about that. It's a internet issue we have down here.
Everybody, thanks for hanging in there. We just want to make it better for all of you to hear.
Yeah.
So give it another second
Yeah.
or two for Shondell to call
We'll make
in.
sure everybody gets a copy of this presentation as well. So I think he's dialing in. Hopefully it's working soon.
All right. Is there
That's
any
better. That's much better.
talk?
That is much
Okay.
better.
Yeah, I do apologize to everyone, but we do want to make sure you hear me okay. So okay, good. All right. So I was at the my health page rewards. This is the breakdown of how the rewards are earned. Again, this is a copy of this in your portal. So any onboarding, excuse me, you can see they can earn up to these points. They can earn up to dollars for them. And again, those rewards can be used for. Some of the restrictions, like I said, just make sure they're 18 years or older. And then, like I said, each member can take this, can't even talk right now. Can take this up. So they can do this as well. So. All right, so this is just a great thing. We love sharing, but nearly over 400,000 members have taken advantage of this My Health page. and looking at close to $30 million in rewards were earned with this. So you can see this is like a great seller out there to members, as well as myself, because I took advantage of this. I helped pay as well. Member discounts. So your member does have discount opportunities out there. So through Ambetter, we do offer gym memberships and discounts through that. Members does have to create an account, so they will have to go through the site. If you do need the link or anything, do let me know. But do let your members know in case they like to work out. And plus, it's getting cold, and with hibernation, and we like to be sitting around. But this is a good benefit to let members know to keep that self fit. There's some of those perks. So again, with this, you got the home gym membership, digital fitness classes, and other eating services as well. When you do get started, that is the registration code member perks that you'll want to put in. But again, if this come up, just let me know. I'm sure there's a lot of stuff out there. So the formulary, I think the 2024 formulary is out right now. But if you go to ambetterhealth.com, which is the homepage, you go to the For Members tab and you click on drug coverage. Once you click on drug coverage, it is going to give you the new updated formulary that you can click on and save it. So it is a big file. I do recommend save it, or when you get it, click Control F, and you'll go ahead and put the medication in there to see what tiers that drug may come up. If it's not coming up, at times if you need a exception, you do have to reach out to our customer services team. There are some other drugs that relate, that's aligned with some of the drugs out there. Like you may find this drug that's not showing up, but you may find a generic drug closer to that we may have. So just keep in mind. Pharmacy member portal. So members do have access to pharmacies in case they need to look up pharmacies, drug costs, anything of that nature. This is from their member portal. And like I said, it's all pharmacy in case they need to find one or manage their prescription. They can do all this from the portal. Like I said, that teledoc, it is the virtual 24/7 care now. So that is going to be located as well right there in that portal. They want to take advantage of that. It is not available in Arkansas, so if anybody contracted there, we don't have teledoc there. The virtual 24/7 care is 24-hour help. For members, it does reduce the cost of health care in case members don't have a PCP. We do understand it's really good for those rural areas out there. And, this is a great selling point, is a $0 copay for those virtual urgent care visits out there. So great fun. Member experience, just to talk about what Ambetter has been planning to do, some of the changes. The information is including its renewal letters. We don't send a copy of these to the agent, but just so you know how these work, like I said, in September, any discontinued plans, we send those out in September, and then October, those renewal letters go out. So we'll continue to let members know anything about their payment. What Ambetter has done is they're going more digital. As I said, so they give members the option or app where members can take advantage of those services or manage their payment from the app. So that will be all in a welcome letter information to the member. Once they get all enrolled, in case they want to take advantage of that. Also, those payment outreach that we're doing, letting members know how far along they are, make sure they make their payment 30, 60 days out. In case the members you also have access to, obviously in case the members are behind, you can make that outreach as well. So just make sure you leverage your dashboard. This is just a quick snapshot. You see your members, you see the liquid 30, 60, 90 days, and then those are unpaid binders. That's new and renewal. And if you come open enrollment, you'll see that reflected in your portal. The welcome packet, so those new renewal members will be getting the packet. Once you enroll a member, it does take about 7 days from the payment, I would say, for them to get that information. So they'll get the ID card, setting up for a bill or choosing their PCP, network providers, rewards and discounts, dependents, and referrals all going to be there in their welcome packet. Member portal. So going back to the member portal, Make sure, those people out there are not tech savvy. In case they want access to those rewards and benefits or my health pay, they will have to make an account and take advantage of that. So, make sure they create an account. Any renewal members can also just go in and log in. It will give them all this information here, their status, the plan that they're on, all this different information here, claims, anything they need to know will be right there on the homepage screen. And then these are just some of the tabs at the top what they will see. You got the doctors, pharmacy, payments, rewards, the usage, any of their claims or reward points that they earn from my health page or anything about their coverage.
Hey, Shondell, quick question.
Yep.
Will
Mhm.
re-enrollees get new ID cards?
Re-enrolling, yes, they're going to get new ID cards. So any re-enrolling members, renewal members, new members, everyone's going to get a new ID card.
That's a good question, Gary. Thank you.
Yeah,
Okay,
thank
that's
you.
it.
Thank you.
We're caught up.
So this is just a quick snapshot of the cost in case members want to look at where they are in their deductible, what they're paying. They can see that all from the portal. Again, this is from their portal, not your portal that you can see, but at least the member can see from there and where they are. Maintain the coverage in case the member needs to make a payment. They can just do so from their portal here. If they want to enroll in auto pay, they can also do so from the portal as well. Now, I heard out there that I guess once you make a payment, right, and I think with Health Sherpa, it redirects you into making like another payment. So it's kind of like confusing a bit out there because you're like, okay, I made the payment, but now you're saying you make a payment again. So I heard that they changed the language of that. So if anyone has any insight of if that's been updated or so, let me know. But I know that has been an issue out there with the language and once you make a payment out there. But it set it up to auto pay though. The member can only do so from their memo portal. I know Ambetter was trying to work where you can do so from your broker portal. They are still working on that now. I can't guarantee that's going to be up by open enrollment because a lot of XT stuff involved. But as right now, the auto pay they can do so, setting it up to the member portal. And I think Health Sherpa too may give you that option as well right now. Communication preferences. In case your member, wants email or digital, they can also do that from the portal. I know, members get tired of getting a lot of stuff in the mail. We don't even check our mail some. So member support. So this is here option for members out there, different programs, Smart for Your Baby, Nurse Line, and then the resource center, we have care management as well as health management. But just let your member know these are program initiatives, just to take care of their well-being out there. So our members here, as I said, they are doing a lot to give members that great experience out there. So they're doing a lot with communicating to the member. They're doing a lot with enhancing the portal, as well as the going digital. All right, so those renewal letters. So we are continue those renewal letters. Like I said, those new ID cards are going out in December. So they will be getting those new ID cards. Again, those renewal letters, they'll go out. It's just a quick snapshot of how it looks. I'm sure some of you all may have seen. If your member has follow up, to let you know. So I know some members out there would get like estimates, like, hey, I got a letter and it's saying this is what my premium is going to be. But just notate that it's just an estimate. It's not what they're going to be paying out there. I know CMS have required us to put an estimate there. I think last year we had the okay not to, but CMS has required it to have that there. So just FYI, auto renewal. So if anything hasn't changed within the circumstances, that is going to roll over. There's nothing you need to do. And then, like I said, those renewal letters was mailed out on October 31st for those renewal letters. And then that's it with that one. So plan, just a quick dive in with the plans. So what's new for Ohio? So we have the introduction of the vision and dental offering from CMS. We have removed the CMS name, as you remember, with CMS standardized plans, but we have removed the CMS name from standard plans out there. And then we have that the event, Ambetter virtual access is no longer available. Then Ohio is going to be expanding into 4 counties. So we got Monroe, Noble, Perry, and Wayne that we're going to be expanding into. And then our network partner highlights is the University Hospital Health Systems. Okay, and then our off exchange vision digital bios is not going to be available for 2024.
Okay, I want to jump in here real quick, Shondell. So for added emphasis, you are no longer offering the virtual access in Ohio for 2020.
Correct.
Okay, so just not going to be an option. I guess that's fallout from the Babylon thing, right?
Yeah, right. Exactly. I'm not sure what really came to that point. They don't really tell us the ins and outs. I mean, but it just was news shared to us, and I was a little bit surprised too. Just looking at the amount of members we have on there, but yeah, it's just what they expecting
Yeah,
on Ohio.
that company, I think, went bankrupt, unfortunately, and it caught us all in a lurch, caught a lot of Ambetter members in a lurch. So it's nothing you did, just the way things worked out.
Yeah.
So we're sorry that it won't be available next year, but I just want to point that out. Thank you.
Yeah. Yep. All right. So I did mention those 4 counties that we're going to be expanding to in Ohio: Monroe, Noble, Perry, and Wayne. So our portfolio is the core plan. So we have the bronze, silver, and gold. So just to break down here, within our gold plan, you have the complete gold, everyday gold, clear gold, and standard, and then the silver, complete, clear, focus, and standard silvers, and then the bronze, choice, everyday, elite, and standard. So I mean, really based on the members, income level and where they fall on. You may see some differences within some of the MOOP and some of the plans. But we do have these plans on the website at ambetterhealth.com. In case you want to look at the plans. I believe 2024 is up, if I'm not mistaken there. So the core network, as I mentioned, is the University Hospital Health Systems. Okay, so if your members have a core plan, and this is a good thing too, they can cross network lines. So, hey, I just went to Florida and I need to go see a doctor or something, as long as that provider is in network, they can use that core plan to cross state lines. So it doesn't matter. So I do want to point that out. But yeah, university hospitals, just a little information on them. They are quite a big network and able to get in network with them 2024. But just to point out university hospital health systems that we have. With the plans, I'm not going to go too dive into the plans there, but we do want to point out some of the plans there, like Focus Silver. This is our lowest cost silver plan that includes the copays for the PCP specialists and labs. So this goes from $6,300 from the base deductible as low as $0 under the percentile. You got the no charge, obviously, for the telehealth services. Our generics are about $3 respectfully across. And then you have the urgent cares that's respectfully across as well, starting at $60. So again, enough of that, just letting you all know some of the plans out there. The choice bronze plan, which is the HSA eligible bronze plan, it does have a matching deductible and max out of pocket for this. Okay, and then for the rest of the visits here in labs, it is a 0% after the deductible. The clear gold. So this is the lowest cost premium gold plan that's on the core portfolio. This does have the deductible at $900. Max out of pocket is $8,700. You got your copay at $25. And then you have your urgent care at $60 and $0 copay respectively. So adult vision, and I did mention this earlier that they don't promote this, you all. So there is a copy of this in your portal that you can get information on how it's broken down. But what's on the screen, as you can see, our exam and eyewear, they get a $0 copay, 1 visit per year. Eyeglasses is a cover up to $130. Okay, you got the lenses that's cover up to 100% covered, and then our contact lenses. Now you have to be 19 years of age and older. Okay. Now we do use once you go on to find a provider, let's say for example, you're looking for, okay, who do I go for the provider and network? So just go to the guide.ambetterhealth.com, right? And in case you're looking for, a dentist or, or anything around vision, it's going to direct you to another site. So Involve Vision is our, through Vision is Involve Vision. And then, for the dental, that we have, I have to go back to see what the dental is. I can't recall, sorry, but if you put in, let's say, dentist, in that, that search box, it's going to take you over to another site, pretty much. But in case you got questions, let me know. I just want to point that out there. But the adult dental, you got the $1,000 covered person, routine dental for the class one, $0 copay, basic dental, 50% co-insurance, and some of the major restorative work is 50% as well. Any out of network we don't cover, but there are no waiting periods. Off exchange plans. So those off exchange plans, anything that's ideal for customers. I mean, you may see some reflecting pricing. I've seen in some of the plans where it was a couple dollars off. It was maybe $10 to $15 off. So you may see some options in there in case you can get a cheaper rate for off exchange. Obviously, those that don't qualify for subsidies. But you will get the same network, same thing through on exchange, okay, for off exchange. And you can do all this through your enrollment portal. So just the top reasons to sell. I mean, this is just some of the network. This is not all of our network. We just put some of these networks here for you all. As you see in the Cleveland area, we have the University Hospitals Health System. There hasn't been any major changes, anything that I've heard with Ohio network or anything besides that. But again, if we have network issues or come across, do let me know, pass that along. But I'm not going to go over anything like that. I think from this, we can just, really look at that My Health Pays, and, in case in areas where, we don't have price advantage, that can be really used for members as well. And make sure you take advantage of our dedicated support team. This is the contact information for everyone. Okay, so you got the broker sales support. These are our great staff that works with any enrollment status, any ID request, commissions, web support, IT, find a provider. They are all there for you at that number, as well as the email that you can send them. And then broker sales, that's where I'm at, where we deal with contracting, training. If you can't, in cases, get in touch with broker support, you can always follow with us or myself. And our number is the same, option 3, and that is the email. And then in the next slide here, this is the Midwest sales team. So aside from myself, these are all of my colleagues that's on the Midwest team. We do handle different accounts. As you can see, Christy Tokars is our director of sales. Tim Condon was our sales manager, but he's no longer with the organization as of last week. So as of right now, we do report to Christy Tokars. Okay, but just in case you all have issues or so, do reach out to your account rep, which is myself, and then again, that's our director of sales. But other than that, I do appreciate you all taking time. I hope I didn't take too much of that time there. But that is the URL for the health plan, and then that's the customer services number for Ohio. But in case you need to get other states, just go to ambetterhealth.com, and then the number is at the bottom if you need a customer services number.
Great.
Can you go back to that network slide? There's a couple of questions in here, but I think people want to absorb that a little bit more.
No, yeah, for sure. Should have left that on there for a minute, right?
Yeah.
We'll get to some questions here in a minute. So guys, if you can hang on, we saw a bunch of questions come in, and I'll address those with Shondell in a second. But yeah, if you could go back.
Yeah, because 2 of the questions are regarding that slide. It's about specific hospital systems.
I think it's let me know if it's showing on my screen.
You're good. It's up, Shondell. So the one question is for the Dayton area. Still, I guess that's Kettering, is that the code for Kettering, I'm guessing? So Dayton is not shown here, but do you know, Shondell, about Dayton, Ohio? Who the hospital is there?
Off the top of my head, I'm not sure who our major hospital is. I knew in some of these, they put this up for a reason because these are most of our, membership and top network there. But in Dayton, I'm really not sure. I can definitely follow up to see, who was, agent was that?
That's
Well,
right.
I mean, you can, I mean,
In the past, you've had Kettering Health Network. Stands to reason that's what it'll be this year, but we can definitely confirm.
yeah,
If
yeah,
the other
yeah.
network is called Premier Miami Valley, and ideally you would get both, and we'll keep an eye on that.
And then, like I said, you can go to that provider guide too, and if you just type in hospitals in the zip code or county or whatever like that, you will pull up those in network providers. But we haven't had any. Yeah.
Yeah, Shondell, just a question, and this is something that timing is the issue. So, granted, you're adding university. If someone was to go out to the provider finder today, would they see university there? I don't think so, right?
Yeah,
Is it
no. So that's
still
gonna, yeah, they should see that right now at this moment, like today showing up. They're still working on making sure that's up by open enrollment with the network team. But if you go today, I don't think it's up right now, but they are having that up by open enrollment time.
Shondell, might you be able
Okay.
to get us after this, and we can distribute it to the folks on the call, those specific questions, and I'm going to take a screenshot of them real quick so that
Yeah. What I'm gonna do,
you'll know
is,
exactly which ones they're asking for.
yeah, and what I'm gonna do is too, like, if I get my hands on like network grid or something like that, that can just tell you strictly, like what we got in network, I can pass that along. So I can see if I can get that network grid for you all out of Ohio.
Perfect. Thank you.
Yeah, I'll work on that.
Because it's all about network.
Yeah, absolutely. Network. I could, now, was there
Yeah, we've got some
anything
more
else?
questions. Yeah. Tell me
Okay,
when
take
you're
your
ready.
time. Take your time. Yeah, go ahead.
Okay, you ready for some questions, Shondell?
Yeah. That's my ability.
Okay.
I'm taking my notes
Now,
too.
this
Okay.
pertains to if you want to go back to the silver plan in your deck. And does the telehealth mentioned in the silver plan square with no virtual access in Ohio for 2024? And this comes from a very eagle eye agent who saw that.
Yeah, it was kind of
Silver
confusing
plan.
because you talked about it as about saying good things about the program, and then it's not here. Is it virtual not here in Ohio at all, Shondell, on any plan or just for specific plans?
So that's a good question. So we wasn't going to have the virtual care in Ohio at all. In this sense, they had this Focus Silver up that has no charge. So what I can do, I can get that plan designed for Ohio.
Yeah.
I'm not sure. Yeah, no, that's a good question though. That's a good question.
Yeah.
I'm glad you brought that up because with the presentation slides and how they did this in town, they was making changes. I'm not sure how this was. And so I could have known that for myself about getting that confirmation on the virtual in Ohio.
Yeah, I think that slide should have been updated maybe because as I see in the lower right-hand corner, virtual care visits only when powered by Teladoc. Teladoc is
It's a brand.
It's a brand. It's not, a generic service. Teladoc is the actual name of the service offered in other states, right? We mentioned that earlier. Teladoc is a trademark name, right?
Yep.
So, I think this slide wasn't maybe built for Ohio in this instance, but the other slides were. But,
Yeah, there's always
Yeah,
a national deck that's
Yeah.
doesn't always jive with local states.
yeah.
Mm-hmm.
So,
Well, thank you. I appreciate that. Point that
okay.
out.
So more
Yeah.
questions. So again, we're going to focus on, a later period where we're going to put a more comprehensive list of the hospitals. There's no way. There's so many hospitals in Ambetter's network. So,
Mm-hmm.
the question about what actual hospitals are in network, I'm going to say dozens and dozens upon dozens, and we can only touch the surface. So we'll get a more comprehensive list of the hospitals, and
Sure.
by all means, do the provider finder search after November 1st. I have that in my favorites tab. I consult it all the time. That's the Bible. So whatever you see out on the provider finder is what you can hang your hat on. Okay, written slides and whatnot are nice, but ultimately the record of the important thing is the provider finder. So another question was, do they remove SumaCare Health System in Akron from the network for 2024? We'll get that answer for you.
No. Yeah. Mm-hmm.
And something about plan website and Cornerstone number. Maybe Kathy, can you elaborate on that? The plan website. What is the basic
Customer
Ambetter
service number.
email address? And we have a hard stop at 2:30, so I'm going to wrap things up as much as I can here in the next 5 minutes. Can you rattle off the website?
It was one of those pages. It was near the next to the last page that had all the
I sent
contact
everybody
info.
a question. I'd send everybody a chat on that. I think it's guide.ambetterhealth.com for that guide. So that's the website that he used. Just a couple more comments here. A lot of questions about network. Again, we'll urge you to check the provider finder as of 11/1, and we'll try to get a comprehensive list together for you. And it says, does he mean UC does he mean the one in Cincinnati or the one in Cleveland? So
there is no UC in Cleveland.
University
UH, we call it up here.
Okay.
Yeah.
So University Health UH, and then UC might be the one in Cincinnati. There may be one option in Cincinnati, but again, we'll get that stuff to you later.
For sure.
These slide decks are printed way in advance, so everything is such a moving target. Are all Tri-Health hospitals in network? Again, we'll get to that later. Christ Hospital, no longer in network. Again, that is not, that listing there was not the ultimate
nope.
So again, when it comes
Christ
to
is
network,
probably in network, and
right.
I'm almost certain that Christ will remain in network. As mentioned about UC, more questions about network. Again, let's get a subsequent email out to everybody about networks. Okay, so he's just hitting on the high points. How do we find renewal premiums? It's an excellent question. Okay, so I want to point out something, and this is in general with every carrier. Despite your clients getting a renewal letter, okay, that renewal letter is not to be, fully trusted. You got to take it with a grain of salt, because those renewal letters are generated based on other parameters, including, what the previous income level was, what the previous FPLs were, and what's more, it didn't take into account that there could be some mapping taking place. So you do need to go on Health Sherpa or one of the other websites and just run the numbers. A renewal on Health Sherpa, it should populate with a new renewal premium when you hit renew. So it's got to be an active renewal, okay? So Now, Shondell, will the producer toolbox, will that furnish a renewal premium, you think?
The producer toolbox.
Yeah, book of business.
I mean, they're gonna have to actively just get that memo and see what they're gonna look like for 2024 if they want to get their premium. No, it might be a lot of members out there because like you got to sit here and like I gotta get all each member and get what they're going to be 2024. I mean, unless a member asks or something, you know, but I mean, we wouldn't know until later down the line what that's going to be. So these letters, and we do put it on the letter, right? I mean, Frank to let them know, hey, it's just an estimate. But yeah, you have to actively just, yeah, that's gotta be
Yep. Yeah, the only way to verify is to go to the website. We're going to wrap up here in a few minutes. Do we know if FFM will be releasing 2024 premiums to healthcare.gov and Sherpa prior to 11/1? That's almost certain they will. Generally, it's the last week of October, and memory serves me, it's always been by 10/24. So that's kind of like Christmas, guys. Christmas in October, that's when, you know, Obamacare rates will be out there somewhere last week of October. Go out there again. That's where you'll be able to reconfigure renewals and whatnot, and work your numbers. So, okay, what was the website for the different plans and customer service number near the end? Okay, that was on the slide deck, wasn't it?
Yeah.
They were in the last few slides. If you just get back there, we should be able to see them real quick.
And unfortunately, Brad and I have to jump off of this and get on another call. But yeah, there it is. Okay.
Take a picture, gang, with your phones. That's
Take a
the
picture.
easy way.
You're all going to get a copy of this deck too. Okay.
Nice.
If there wasn't a question I got to, please let me know. I'll get to them, you know, later today or tomorrow. I think generally the questions focus on the network. Again, the network should be updated with the rates last week of October, or preferably first week of November for network, because that's when the rubber meets the road. And Brad, you got any final thoughts before we toss it over to Shondell for his final thoughts?
No, I just want to thank Shondell for a nice presentation. There's a lot of things built in to the plan beyond premium, beyond network, you know, to help people save money. So that was a lot of great information in the beginning. Thanks, Shondell.
No, absolutely. I do appreciate you all. Like I said, it wasn't for your hard work, we wouldn't be where we are at growth. So we're hoping for a good year, you know, an open enrollment time. So I want to make sure if there's any concerns or issues out there that we get those addressed. So do, you know, let me know. You know, I'm your rep, and everyone should know what's the face behind who I'm working with, right? So, but yeah, just know that I'm here for you all, and we're going to get through open enrollment together, and let's just have a great open enrollment.
Fantastic. Fantastic. Thanks so much, Shondell. Everybody,
Absolutely.
have a great day.
All right. Thanks, guys.